year into the pandemic, medical experts are worried about the potential long-term health effects of missed cancer screenings. Hundreds of thousands of cancer screenings and tests were delayed, with facilities closed amid concerns about the coronavirus. And now the experts fear this could delay critical diagnoses. Mireya Villarreal introduces us to two women who experienced just that.
Let's be gentle. Okay.
Shaving her head was cathartic for Rhonda Johnstone of Roswell, New Mexico.
It was actually really special.
Johnstone is 52 and battling cancer. She has a mass of tumors in her right breast.
When you got the news, what was the first thing that ran through your mind?
Fear. I've got 5 little grandkids. And I want to be here to watch them grow up.
Yeah! But after she discovered the first lump, 6 long months passed before she was finally diagnosed.
What has been the hardest part for you?
I've really had to fight. I've had to fight for testing. I've had to fight to be seen. I've just had to fight for answers, and I don't think that's fair.
Johnstone is just one of hundreds of thousands whose cancer screenings were deferred when the pandemic shut down clinics and labs.
I'm seeing people with advanced cancers.
Dr. Linda Ann Smith is a breast surgeon in Albuquerque. She's now treating Johnstone half a year later.
There were no words for how striking that picture was, how big the tumor was. It was everywhere. It was all 4 quadrants. It was underneath the nipple.
Johnstone is getting chemotherapy to shrink the tumors so Smith can operate.
Yeah, mammogram saved your life.
Surgery has become increasingly common during the pandemic.
We're doing harder surgeries, sicker patients, people who've had to go through extensive treatment before we can take them to surgery.
For 59-year-old Yvette Lowry of Rock Hill, South Carolina, that meant chemotherapy. Her annual mammogram was canceled during the early outbreak of COVID, and the backlog of screenings made it hard to reschedule. In August, Lowry felt 2 lumps under her arm. After 3 months of delayed screenings and tests, she finally got her diagnosis: stage 3 breast cancer.
It's been a little emotional, but I just keep my faith and trust in God.
If her cancer had been detected last May or June, doctors believe they may have been able to prevent the spread. Last week, Lowry had a double mastectomy.
They put our life on a standstill.
What was the hardest part for you?
The hardest part was telling my kids. I didn't want them to worry, and I didn't want to be crying.
Experts predict the number of people who will die from breast or colorectal cancer in the U.S. will increase by nearly 10,000 over the next decade because of COVID-19's impact on cancer care.
We decide at some point.
Dr. Karen Finkelstein, who treats gynecologic cancers, has seen a 30% decline in cancer referrals.
I'm being paralyzed. I've been frozen by COVID because it's changed the landscape of medicine and patients.
Last year has taken a toll on her personally.
You start to feel a sense of despair. The hurdles COVID has forced us to face this year, some of them have been insurmountable.
Love you.
It's that love from Johnstone's family and for her family that gives her the strength to keep fighting.
It doesn't seem like you're going to take this sitting down, are you?
No, I'm not. I'm going to get it. I'm going to get it good.
For CBS This Morning, Mireya Villarreal, Dallas.
And we want her to get it good, too. Our Dr. David Agus, who specializes in treating patients with advanced cancers, joins us now. Good morning to you, David. This is such a great wake-up call to those of us who have put off screenings for whatever reason. So here's a question. What screening should we absolutely not put off or delay?
Well, you know, during COVID, there was almost a 50% drop in the diagnosis of breast cancer week by week. And so those breast cancers are still there. They're going to be diagnosed. So you need to get your mammogram. You need to get a PSA test if you're a man, a lung screening test if you're a smoker, colonoscopy, all the standard screening tests. And you need to go to your doctor to get that standard blood test. Other things are found in the blood test. Hospitals have remarkable programs now to prevent, and most doctors are actually, and nurses are vaccinated. So it is very low risk to go get the screening.
You know, and then some vaccinated people are reporting swollen lymph nodes underneath their armpits, which can sometimes be mistaken as a sign of breast cancer. What do you have to say about that?
Yeah, Gail, I mean, you're right, is that after the vaccination for 6 to 8 weeks, lymph nodes get enlarged, and that's part of your immune response, and they're actually lymph nodes in the breast. So you can get false positives if you have a mammogram or other medical tests during that time period. So if you can, if they're elective, if they're part of your routine screening, delay it 6 to 8 weeks after the vaccine.
Can I talk about the AstraZeneca, the latest thing that we're hearing there, that now they're saying the efficacy is now 76%, down from 79%. It's very slight, I get it. But should people be concerned? It seems every day there's something new about AstraZeneca. Are you worried?
Yeah, I'm worried about the communications group. I mean, this was a problem of omission. They put the data they had in February, but February to March, there were another 49 cases, and the data went from 79% to 76%, but the data in the elderly went from 80 to 85%. So these are small changes. It is still an amazing vaccine, and we shouldn't let this noise affect our acceptance of something that could save our lives.
All right, Dr. David Agus, thank you so much. We'll be right back.